Thank you again, Anuja, and I would like to thank OAVS for giving me this opportunity to present on the basics of the eye and be part of this, program, the optical dispensing program. Just to give an overview of, what we are trying to do here is, there are a lot of optical stores. It could be outside or attached to an eye hospital. As Anuja said, there are people who are in the industry for many, many years, or there are freshers in the industry. But most of them, when it comes to optical dispensing, because there is no proper or regulated optical dispensing program in this country, unfortunately. So we have been trying for many years to train people and across all the be it optical stores or chain of stores, we have trained over 1,000 people. But it is always important for us to understand the basics of eye before even we think about optical stores. So I tell this to all, and this slide is very, very close to me because, see, my job as a presenter or as a trainer is to give you knowledge, is to create awareness among all of us, all of you. And one of the things I tell to all of them whenever I present is, it is a teamwork. Okay, like what Dr. Sendil initially said. The problem is in front of us, whether be it an ophthalmologist or optometrist or optician, all of us have to come together and then attack the problem so that we could, give some sort of solution to the problem. Okay, so I always tell that for better outcomes, teamwork is, the key. Okay, so with that disclaimer, I am starting this. So one of the fundamental questions that all of us have is, like, some people said they have 21, 20 years of experience. Some said 10 years of experience. But the fundamental question is, what is it that we are going to gain, by understanding the anatomy or physiology of the eye? Okay, so this is what we need to ask ourselves before even starting this, session. So one of the things that I always, you know, uh, hello,
Yes, sir, yes, sir. Please continue.
yeah. So one of the important things that be it a store or you are in a clinic, wherever you are, it is important to understand how we are able to see better. Okay, how is it that we are able to see for near? How is it that we are able to see for distance? How quickly we are able to see immediately from distance to near or near to distance? All these things fundamentally, how we are able to achieve, or how you are able to see instantly. Okay, why this understanding is important, you will be able to understand towards the end of the session. Okay, and what is the clinical relevance of all of this? Okay, that is also you will be able to understand towards the end of the session. Okay, so vision depends on many structures. Okay. And if we have to dispense, okay, correctly, then we need to have a clear understanding of all of this. Okay. So one of the fundamental thing is eye is always compared with the camera. Okay. Two scientists, namely, Hatham and Kepler, these two, before inventing the camera, they studied the eye. Okay, so they were fascinated towards how we are able to see things clearly, how sharp we are able to see. So from that, they invented the camera. Okay, so when we want to compare the eye to a camera, see, in our eye also we have a transparent structure in front of our eye, which is called as cornea, and then lens, which is, when you talk about camera, it is the camera lens. Okay, when we talk about iris and pupil, there are aperture and opening in a camera. Okay, and finally, there is a structure at the end, which is the retina, and here there is a sensor or film. Okay, So when we talk about the optic nerve, which is at the end, which takes the signals to the brain, here it is a cable to the process. So it is that is why it is comparable to a camera. Okay. Now let's try to understand if the eye is a camera. Okay. So I said eye is always compared to a camera, right? So if eye is a camera, which part acts like the camera lens? Anyone can answer. Just which part is like a camera lens in our eye? Is it,
Can type in the chat box
you
also.
can also type in. So so in between I have some questions. So if you can
Crystalline lens. But yes,
so which part acts like the camera lens is crystalline lens, right? Okay. So what will happen if the camera sensor is damaged? Which I said is compared to the camera sensor in our eye. Imagine if that part is damaged. Yes, retina, you are right. What will happen if something happens to retina? Will we be able to see clearly? Is it possible for us to correct with glasses?
No.
Hmm. So vision will not improve even with the corrective glasses. So these are some of the things that we have to keep in mind. Okay. So moving on to some of the structures. Okay. External structures like eyelids. Okay. So eyelids, as you all know, that it protects our eye. Okay. And what does it also do? It has a, if you look at that picture, it has a meibomian gland. Okay. Interesting structure because it secretes one of the most important, lipid secretion, what we call. It is an oily secretion which helps us to which helps us in lubrication. Okay, that is why whenever there is this meibomian gland dysfunction, what happens is there is fluctuation in vision. Why there is fluctuation in vision? Because this oil secretion is not happening, because of which all the tear which is underlying to these lipid layer, it gets evaporated, and that's why you see a lot of these dry eye and other things are happening nowadays. Okay, so whenever you have to definitely keep in mind that whenever there is a fluctuation in vision, you should think about this, tear stability. Okay, it affects vision. So, and also nowadays we use mobile phones, right? A lot of the screen time has increased. Okay. And what we fail to do is we fail to blink. Okay. So, when we fail to blink, what happens is there is this tear film instability. That means the stable tear film is required for clear vision. So, whenever we fail to blink, what happens is there is this tear film instability. Okay, so there is a fluctuation in vision. Okay, so one of the other things that is important for us to also understand is for lid position to be lid position also affects the frame fitting. Okay, and the lens centration, and for a progressive lens performance, you have to make sure that the lid position is correct, correct, and the lashes doesn't rub the lenses. So that is something that you have to keep in mind. In some cases, if the lashes rub against these lenses, then you need to adjust the frame. Okay. Some of the common lid conditions include this blepharitis, ptosis, tie, meibomian gland dysfunction. Don't worry about these hyphanda names. The reason why I want you to remember this is because of this one condition called as ptosis. Ptosis is nothing but drooping of eyelids. Okay, so you know in some of the hospitals you would get some patients with either one eye ptosis or both the eyes ptosis, this drooping of eyelids. So what one must know is, as a dispensing optician, is that there are glasses which is called as crutch glass, which is available so that you can lift these drooping eyelids so that they can easily see. Otherwise, these droopy eyelids, people will be finding it difficult to see. Okay, so you have to keep this point in mind. So I hope so far we are okay. If there are any doubts, you can put it in your chat box so that we can try to answer towards the end of our session. Okay, so moving on to conjunctiva. Okay, conjunctiva is a thin transparent, which is the inner surface. It's called as palpebral conjunctiva, and the outer white part of the eye, which is called as bulbar conjunctiva. Why again this is important for us to understand is because of the lubrication it provides. Okay, we need to have a healthy conjunctiva for us to feel comfortable and for us to see better also. Okay, comfortably. Okay. Another thing which I thought I will cover here is, see, whenever in some seasons, these are all seasonal infections like conjunctivitis. Whenever people come with, say, red eye or pink eyes, it could be infection like conjunctivitis, where they may come to opticals also sometimes. Okay. So what we have to keep in mind is, if you suspect that they have infection, then it is better to treat the infection before they try these lenses or frames. Why? Because if they wear these frames and if you fail to clean those frames or lenses, and if that is being tried by another customer, then they may also get the infection. So these are very basic thing, but I think we have to keep in mind that whenever you suspect that somebody has an infection, you could probably suggest them protective glasses to prevent the spread of infection, and then ask them to report it maybe after a week or something like that. Okay, so that we generally avoid showing them frames or lenses at that point of time. Okay, so this is something important. And if you feel that they have complaints like dry eye or irritation, burning, and if there is any fluctuation of vision, or if there is any allergic reactions, then it is also better to refer them to an ophthalmologist, treat it before we prescribe lenses or before we try out some glasses for them, because the vision may not be clear when you assess or when you dispense the lenses. Okay, so this is something you have to remember. Okay, now again to question: can dry eye cause blurred vision even if the power, whatever power that you have given, is correct?
Yes, sir.
Possible? Yes, very good. So why do some patients say vision is fluctuating during the day? That means you are giving a glass, but they are comfortable. But during the day, they say that it is fluctuating. My vision is fluctuating. So, what could be the reason again?
Dry eyes. Dry eyes.
Yes. So, tear film stability is something that you have to keep in mind. Okay. So, it need not always be like the power or the frame or lenses. So, it could also be one of these. Okay. Good. So the next one is sclera. Okay, sclera is the white tough outer coat of the eye. But why should we know about it? Because this has a very important role as in myopia. Okay, so which we all have to know about it, because one of the key refractive errors, isn't it? Okay, so this maintains the shape and also the axial length. We all have heard about high myopia, right? Whenever the power crosses -6 or above, we call it as high myopia, right? So it means what? High myopia is always associated with longer eyes, right? So whenever the eyes have high myopia, then the frame and the lens, it is very critical for us to understand, isn't it? So the lens centration is important. The frame that we select is very, very important. Why? Because if you are going to select a bigger one, then the most of the thickness would come into the frame. So you have to select a frame which is not very big or very small. It should be adequate for their face. So these are important for us to understand. Okay, where sclera plays a major role. Right. So now we will ask a clinical scenario. Now a patient is coming and he's coming and complaining that I have burning and fluctuating vision. So what do we tell? How do we handle this? What are the likely cause? As we said, it could be dry eye. You said it correctly. Or, as I said, lead dysfunction. I told you about the meibomian gland, right? I showed you the diagram. Okay, so it could be because of the meibomian gland dysfunction also. Okay, so how do we manage this? It is always better to manage the condition before we dispense the glasses here. Okay, that's why I said in some of the cases it is always better to work as a team. I did mention, right? So we have to take ophthalmologist help or optometrist help here so that we can manage the condition before we dispense this case. Okay, now the next one is you are you have prescribed contact lenses. Now the patient is wearing, but for some reasons he is not able to tolerate the contact lenses. So now he is coming to you and complaining, I'm not able to manage or tolerate the contact lenses. So what will you tell or how will you manage here? What are the structures that so far we have covered? So remember that and answer. So, so it could be because of the conjunctival irritation. I did talk about conjunctiva, right? So the conjunctiva should be very healthy so that we should, make sure that the conjunctiva is very clear, and when we insert the lenses that they are comfortable so that they are not having any kind of irritation. Okay, in this case the patient has used the lenses but he is coming with some discomfort. Okay, okay, so again here either we need to refer or modify the lens plan. Okay, so that's the action plan. So it all boils down to clear vision depends not only on optics. Okay, that's a fundamental thing, but also on ocular surface health, like what all I said, conjunctiva, cornea, all that, right? So these are all very important that we have to make sure that all these are all healthy so that the patients are comfortable. Okay. And also the tear film is very critical for visual clarity. Okay. Now moving on to one of the important structures, which is cornea. Why I said this is very important? Because cornea is nothing but it's a clear, transparent structure which is sitting at the front surface of the eye, right? Unless this structure is transparent, light rays will not pass through. Okay. So this is very, very important for us to understand. And also if you imagine eyes, the total power is 60. Okay, so majority of the power is taken by this structure, cornea. Okay, so 70% of the structure is taken by this cornea. Okay, so though there are many structures, like you see from the figure there, you see epithelium, which is at the outer layer, and the inner layer is endothelium, and in between you see Bowman's layer, stroma, and decimates, and so on and so forth. The important thing that we need to understand about cornea is, suppose, can anyone say what is the normal corneal thickness in microns? Do you know? What is a normal corneal thickness? Okay.
Microns. 550 microns.
Very good.
550
Okay. Very good. So the normal corneal thickness, if it is 550 microns, okay, the stroma, are you able to see that? The stroma contributes to 500 microns. Okay, so that's why I have shown this here like this. Okay, so uh, why we need to understand cornea? Okay, why? Because it has a major role as far as refractive errors are concerned. Okay, if if you actually see a cornea which is very steep and which has increasing power, then what error you expect? Myopia. Okay, and if it is a flat cornea, then it is hyperopia. Okay, imagine if the cornea is not very regular and if it is irregular, then you know that there could be astigmatism as well. And apart from the irregular curvature, and if there is irregular thinning also, and some part of the cornea if there is a protrusion, then it is called as a condition called as keratoconus. Okay, so most of the refractive errors are corneal in origin. Okay, so that's why cornea is very, very important for us to understand. Okay, okay, now you try to answer this. Which structure gives maximum power in the eye?
Cornea.
Okay, how much approximately? Do you know?
45 diopter.
Yeah, approximately you can say that. What is the total power of the eye?
60 diopter.
Yeah, very good. Yeah, very good. So imagine if the total power of the eye is about 60 diopters. So the cornea contributes to about 43 diopters. Okay, so you can say that plus 43 diopters. Okay, yeah, okay, good. So if the cornea shape is not very regular, so what do you expect?
Keratoconus.
Okay, either keratoconus or even astigmatism or distorted vision. I did not say, it has a cone. I did not say it has a thinning of cornea. Okay. But just if it is irregular, then you can say it is probably astigmatism. Okay. But if it is irregular and thinning, and if the if it has a cone also, then it is called as a keratoconus. Okay, so we will try to understand about keratoconus in the following slides. Okay, now there is a mini case question. Okay, so let's try to understand. If a patient has got a frequent change in power, okay, and also distorted vision, what will you suspect? I will give about 5 seconds. Myopia. Frequent change in power and distorted vision also. Will myopia give you distorted vision? Okay. So whenever imagine, you have to think this, very clearly. Whenever there is a distorted vision, okay, that means that means very clearly the surface is not very regular. Okay, only then the patients will have distorted vision. So this is very important for us to understand, because when you give glasses, imagine you have given correct glasses, for example, whether it is -2 or +2, okay, but still patients are complaining that their vision is not very clear, or if they are saying, my vision is very distorted like that, so you should suspect something in cornea. Okay, so this is important for you to remember. Okay, so the next one is aqueous humor. Okay, it's a watery fluid between cornea and lens, and this is the one which maintains the intraocular pressure. Okay, and it also provides nutrients to cornea as well as lens. Okay. What happens if the fluid in the eye does not drain properly? What happened to the eye?
Increase intraocular pressure.
Yes. What is it called?
Increased dioptry. Glaucoma.
Yeah. So a group of conditions are called as glaucoma, but you can say that at least glaucoma for now. Okay. Because if you have to call it as a glaucoma, then you need to also understand the visual fields. You need to understand the fundus of, the eye also. But you can definitely introduce here the term as glaucoma. Okay. Okay. If the eye pressure, do you think that eye pressure is important for vision? Is eye pressure important for vision? If yes, why? Why? Because sometimes, see, if the eye pressure is very high over a period of time, and if you are not controlling the eye pressure, that can affect the nerve. What nerve is that?
Optic nerve.
Very good. Okay, so that can affect optic nerve. Okay, so and then it can affect the vision as well. So all this can happen over a period of time. Okay, so this is also important for us to understand. Okay, the next structure is iris and pupil. Okay, the colored part of the eye, okay, surrounding pupil is the iris, and which controls the light entry of light as well. Okay, and what we have to understand here is, see, whenever there is a light which is very bright, and whenever the light which is not adequate, that means dim light. Okay, what happens to the pupil? See, when you shine a torch of light, what happens? The pupil constricts. Okay, and when someone goes in the evening, or when the light is very dim, what happens is pupil dilates. What happens when the pupil dilates? Have you ever had a driver saying that, when I drive in the later part of the day, I'm not able to drive comfortably, whereas when I drive during the day, I'm able to drive comfortably? Yes, isn't it? So what happens here? Because of the dim light, the pupil dilates, right? So what happens when the pupil dilates? See this slide. Okay, see, whenever there is this dim light, the pupil dilates, and because of which, what happens? Because of the aberration, okay, because of the aberration, there is too much of glare and halos during night driving. So, what is the solution here? Okay, so whenever there is this glare or halos, so we can probably suggest anti-reflection coating and or premium lens design are to be given, so that we can manage this to some extent. Okay, so that is why this slide is important for us to understand. So larger pupil, as I said, will have more aberrations. Okay, what are aberrations? I have put there, right? Larger pupil means there will be more aberrations. Smaller pupil means sharper vision, right? Okay, so just make a note of it. I think let us take that as a class assignment. Okay, so you need to submit it within a week's time. All of you have to write a short notes on aberration and how it affects our vision. Okay, so that is the first class assignment. Okay, the next one is, suppose somebody is complaining that, when I drive in the night, I'm not able to really drive properly because of the oncoming vehicle lights, and I'm finding it difficult to drive because of the glare, because of the halos and things like that. Okay, what will you advise him? It could be because of this, or maybe he's also developing some kind of cataract also. Okay, that we will see in the coming slide. So what can you recommend? What can you? Okay, so you could advise some of the coatings. Okay, so remember that. Okay, so why do patients complain of glare at night? It's mainly because of the pupil size. Okay, for now at least remember that pupil size also one of the reasons why they complain glare at night. Okay, and do all patients see equally well in dim light? No, because I said because of the aberrations, there could be problems for some. Okay, but you have to tell me what are these aberrations or and how it affects our vision. Okay, that's the assessment for you. Okay, so far is it okay? Can we progress to the next structure, which is the crystalline lens, or in short, lens? Is it okay? All of you are okay? Okay. So next is the next transparent structure is the crystalline lens, which is biconvex in nature and which is just behind iris and pupil. Okay. Unless the structure is transparent, okay, again, like cornea, the light rays will not pass through. So that's why some of them after 50 or 60, they say that I'm not able to see, is one of the reasons that slowly because of aging, what happens is this crystalline lens loses its transparency, right? So which is called as cataract, right? So because of which the light rays are not passing through this structure, are not passing fully through this structure, so because of which they are not able to see clearly. Okay, so it loses its flexibility as well. So okay, so uh, so what is that called as? What is accommodation? Have you ever heard about this term accommodation? So accommodation is nothing but ability of the eye to change focus from distance to near. Okay, have you ever wondered how we are able to see at distance and suddenly at near as well? Similarly, from near, immediately we are able to see the distance, okay, instantly, right? How we are able to do that? That's because of this structure. Okay, so what happens when we look at distance? When we look at distance, when we look at distance, the ciliary muscle is relaxed and zonules are tightened so that the lens stretched or flat. Okay, the lens is flat here. Okay, whereas suddenly when we are looking at this near target, what happens? The ciliary muscle contracts, zonules loose, and then lens is thickened. You see, then it becomes high power. So the same structure for distance, there is a power, and for near, it thickens and it gives high power. See, such a beautiful structure. Okay, so till 40 years, somehow we are able to manage. Okay, but what happens after 40? Okay, there is loss of accommodation, right? So what is this age related loss of accommodation? this lens become less elastic and more rigid because of the age. Okay, so the ability of the lens to change the shape, it gets reduced over a period of time. That is why we are substituting with lenses outside. Okay, so it usually starts around 40 years. Sometimes it could be little early also. So, and it progresses gradually until say 60 or 65 also. Okay. So what are the symptoms? What is it that they would come and tell you? All along I was reading very comfortably, but for the last 1 month or maybe say last week, I'm not able to see clearly for near. Or some people may say that, say, I was reading at a normal distance, but now I'm holding the reading material little farther away from the normal distance. Okay, so some people will have reduced near vision, reduced this near vision in dim light alone. Okay, so these are some of the symptoms, okay, of presbyopia. So immediately you ask them the age, and then you try to understand what is going on. Okay, and then you try to suggest some management, optical management of presbyopia. Okay, most of them if they are wearing for the glasses, they would say, no, I just got the reading glasses from a supermarket. Or some people, they try to wear the bifocal lenses, or currently progressive lenses are available. Or some people, they don't want to wear glasses, they want to try some contact lens options. Okay, so these are some of the optical management of presbyopia. Okay, right. Now there are so many people here who must have definitely handled such cases. So now I want to ask you is, at what age do most people need reading glasses? Normally. Yeah, so around 40, right? So around 40 is
40,
what
yeah.
we generally, or sometimes in Indian scenario, 37, 38 also some people may have. But actually, when they come to you, it is also important that you tell them to check their eyes. Why? Because there could be some refractive error for distance, because of which he may not be able to see for near as well. So this is something that I want you all to understand. So straight away, do not encourage them to use reading glasses, because at that point of time, maybe their vision is good. But over a period of time, their distance vision may be blurred also, may become blurred also. So my suggestion is, when they come and ask for reading glasses, it is better to get their eyes checked, make sure that there is no distance correction. Then probably you can suggest for reading also. It's fine. Okay, you are right. Okay. So is presbyopia a disease or a natural process?
Natural process.
That's the process.
Yes. Okay. So,
Natural.
yeah, so it is a natural process. Okay, natural aging process, you can say. Okay, good. Okay, so there are reading glasses, bifocal glasses, progressive and contact lens options. So which structure helps in near vision?
Reading glasses.
Now, which structure?
Ciliary muscle.
Is it ciliary muscle?
Lens.
Yeah, lens. No, lens. Okay. Okay. Does the lens change shape or position?
Shape.
Yes. Shape.
Yes. Lens change mostly the shape rather than the position. Okay. Good. So what we do is, see, when they come, if it is usually around 40 years and we check for the distance, and based on the age and working distance, we try to give them either +1 addition or +1.5 addition or +2 addition, like that. Okay. So, but what is important is whether are they comfortable, whether in both the eyes they have the same power. So how do we know? Again, going back to basics, send them to the send them for a refraction and then get the values and then prescribe. That is the correct way of giving dispensing glasses. Okay. One of the other things that is very important for us to understand is, don't blindly prescribe them either +1 or 1.5 or +2. Why? Because without understanding their visual needs. So what is this visual need? Is because, imagine, I'll give you an example. Imagine, okay, a carpenter coming to you, okay, and if his work is around 40 centimeter or 45 centimeters. Okay. Can you mute, please?
I will.
Okay, thank you. Okay, I was just talking about giving this example that, don't blindly prescribe the addition. Why? Because see, you can just prescribe, say, +1 or +2 or 2.5 like that. But what will happen if you do not understand the visual need? What is this visual need? Imagine somebody like a computer user or somebody like a carpenter, okay, is not a normal reading distance, okay. All these work only for a very small range, okay, either 25 to 35 or 35 to 40 or 40 to 45. So unless you understand what is it that they want, okay, imagine a carpenter who wants to work only at 40 or 45 centimeters. His age may be 40. If you give +1, okay, so his visual need may be very different, okay, or his visual, or if he's 50 years, his visual need is very different, okay. So you have to understand the visual need of that particular individual and then give glasses accordingly. That is why most of the time these glasses, when you prescribe, then because it has a fixed range, then either they have to go closer or they need to bring the material closer, and they are not happy about it, okay, because all along they have been using like that, okay, at all the distances. Now unfortunately you cannot give one glass for all the distances. It has some limitations, right? So here you need to use your common sense to understand what power would suit him for what work or what purpose, okay. If his purpose most of the time is computers, okay, you give a glass which is, say, 60 or 70 centimeter, which would work at that distance, okay. The other times you have to communicate and tell him that this glass is good enough only for that distance or only till that distance, not beyond, or you have to communicate that very clearly, okay. This is something very important. Otherwise, most of the time, once you prescribe, you say progressive lenses are for all the distances, then he is happy, all that is fine. When he's taking the glasses and if he starts using it and he's unhappy because of this communication gap, okay. So this is important for you to understand. Okay, another thing is new presbyopes. Okay, for new presbyope, you are giving a glass either bifocal or progressive lens. Okay, if he or she is not able to adapt it, okay, you need to talk to them, because see, most of the time what happens is they go to a supermarket. Mute, please. Mute, please, mute. Okay, so they go to a supermarket and then they get some reading glasses, because all the reading glasses are very easily available. Okay, but next time when they go to a hospital or this thing optical store, and they refract and they find that, they need glasses for distance, near, and computer, all the distances. Suddenly, you give them a progressive lens. After having used then reading glasses, they will find it extremely difficult. Okay. So they are very unhappy progressive lens wearer. Either it could be because of some fitting or remeasure is required, or because we have not communicated to them very clearly how to use these lenses. So two things are possible. So we have to make sure that we take utmost care in while taking measurements. One, the second thing is counseling is very important. Okay. Other thing is, if he is an office worker, imagine, okay, his work is only table work most of the time. Say, for example, 4 or 5 hours he is in an office, and his distance is only intermediate and near. Okay, there are options available today. Okay, like office lenses. So unless you know about it, then we will not be able to discuss and then suggest. That's why you need to understand that these options are currently available. Okay, somebody who is using a mobile phone, very close working distance. Okay, if we read the book around 25 centimeters, mobile we hold it around 15 centimeters, right? So we need to adjust the add power and then give them. So it all boils down to what is the purpose of this glass. You need to understand, okay, their need. What happens to the lens when we see near objects? What happens to the crystalline lens? I would put it this way. What happens to the crystalline lens? I showed you a picture also of a crystalline lens, right? When you look at distance, how will it be? And when you look at near, how will it be? Will it be very thick when you look at distance?
Thin at distance and thick at near.
Yeah. Okay, good. Okay. So it becomes thicker when you look at objects which are closer by, right? Okay, good. Is accommodation present in older people?
They thick one or thinner one. No. No.
See, what happens is we can't say accommodation is not present, but it is reduced, right? Accommodation is reduced. Okay, that's why we need some lenses outside for us to read. Okay, because there is reduced accommodation. Okay. Okay, so moving on to the next structure, vitreous, right? So vitreous is nothing but a gel kind of a structure between the crystalline lens and retina. It helps our eye to maintain the shape and occupies at least 80% of the eye's volume. Okay, and most of it are all water only. Okay, so any opacity in this region in vitreous, it also affects our vision. Okay, so next is retina. Retina, though it has about 10 layers, we need to understand about this interesting structure, interesting layer, which is the photoreceptor layer, which is the rods and cones. Why? Because rods are responsible for the night and peripheral vision, and cones are responsible for the color vision. Okay. And this is the one which converts the light rays into the electrical signal, and through the optic nerve it sends the signal to the brain. Okay. Okay, so when it comes to some of the common condition which affects the retina, here also we need to understand vision is affected. Okay, how do we manage then? Okay, these are some of the common conditions. Even in India we see it very regularly. you would have heard about macular degeneration, right? Where the central vision is affected. Okay. And in case of diabetic retinopathy also, vision is affected, blurred vision or fluctuating vision. Similarly, in retinal detachment also, it is an emergency condition where there is sudden vision loss. Somebody coming to the optical store with a sudden vision loss, okay, towards the end of the day also, we should not ignore. Why? Because I told you that we need to work as a team. Immediately, you need to contact the doctor, ophthalmologist, or somebody there and inform them, because this is an emergency. You could save their eye, you could save their vision as well. Okay, so you need to understand that it is an emergency. Okay, so even perfect glasses cannot improve vision if the retina is damaged. Okay, please understand. Why? Because retina determines final visual acuity. Okay, which is not only responsible for visual acuity, but also contrast sensitivity, color vision. Okay, so retina is very, very important. Okay, so you may ask, when should we refer? Okay, patients. So whenever there is, as I said, sudden loss of vision, whenever there is distorted vision, which means that straight lines appear bent, okay, or sometimes, people may complain that, there are flashes and floaters in front of the eye, like that. Okay, if there are too many, then also you need to refer. And they may say that black curtain suddenly kind of thing, okay, in vision, that is again emergency. Okay, it could be retinal detachment also. Okay, so just a recap of what is the role of each of these structure. So iris controls the light entering the eye, and we have to understand, whenever there is a glare or night vision, we need to make sure that we give the correct management of glasses. Then accommodation and presbyopia, we did talk about this. Then light transmission, about floaters. Yes, we also said that it is an emergency. Retina, how an image is being processed, and final vision quality depends on how healthy the retina is. Okay, so all these are all important. Okay, now which structure is most important for final vision?
Retina.
Yeah, of course, all the structures are important, but for the final vision, retina is definitely important. Okay, can glasses improve vision if there is a damage in retina?
No, sir.
No.
Yeah, sometimes, if the damage is really severe, glasses may not improve at all. Okay, this is where we will study in the 5th or 6th module about low vision and how we can improve vision further. Okay. Okay, I did talk about macular degeneration, diabetic retinopathy, and the retinal detachment. Okay, one of the things that we have to understand here is about macula and the central part of the retina, fovea. Why? Because it provides us a sharp vision, okay, detailed vision, okay. And there are, as I said, rods and cones, right? Rods are more in the periphery, okay. That's why it helps in the night and peripheral vision, okay. Okay. Now, which part helps you to read and recognize faces? I did tell you about sharper vision. That's a clue.
Macula.
Good. Okay. Now the next one is, imagine a patient with good prescription, okay, but poor vision. What could be the reason? You have given,
Maybe
yes, you have given him a good glass, but poor vision.
yes,
Okay.
retina. Causes
So,
a retina problems.
yeah. So it could be
Or
because of retinal problem. Whatever vision you give, you have taken all the proper measurement. You have done a very good refraction, frame selection, everything you have taken correctly. But still the patient vision is not improving, means it could be retinal issue also. Okay. You could refer him to a retina specialist. Okay. Next, the patient is complaining about glare, especially at night. What could be the reason?
maybe sir dilating pupil.
Okay.
Yes, dilate people, large people.
Okay. So something to do with pupil. Okay. Larger pupil, good. Okay. So possibly you could suggest some good coatings and good lens designs. Okay. Good.
Yes.
Okay. So somebody who is 45 plus, okay, a patient with reading difficulty.
Presbyopia.
Yeah, good. So there is loss of accommodation, and so you could possibly give him some addition. Okay,
Yes.
good. Okay. So you're seeing, or somebody is complaining that that sudden floaters.
Vitreous hemorrhage.
Vitreous problem. Vitreous hemorrhage.
Yes, good. So there could be some changes in the
Vitreous.
vitreous. Okay, again, sudden floaters means urgent referral. Okay, so that is important. That's your role. So each one of us have to understand our roles and responsibility. That is the entire session. Okay. So these are
Yes.
all your responsibility to refer at the right time so that we could save his vision. Okay. Okay. So glasses focus light. Okay, but retina decides what you see. Okay, if the retina is unhealthy, no lens can fix vision. Okay, so accommodation is lost with age, not with power. Floaters may be harmless, but sudden ones, okay, are not. Okay, where does the eye send visual signals?
Visual
Brain.
cortex.
Yes, it sends to the brain. Okay. Okay, so these are about the structures. Okay, so we did try to understand some of the basics and the optical relevance of these structures. Okay, now we will move on to some of the muscles. Okay, which are called as
Alright.
extraocular muscles. Okay, so we have at least 6 muscles, and which all have these are primary actions of those muscles. Okay, but what is it that I want you all to really understand? Okay, is this one: binocular vision, fundamental concept. Please mute yourself and talk. Mute. Okay, so what I want you all to understand is this binocular vision basic concept. Okay, how have you ever wondered how we are able to see, though we have 2 eyes? Okay, how is it that we are able to see objects as one single object and it is very clear? Okay, how is it that brain is able to combine both the images? Okay, so for that, what is essential? Proper alignment of our eyes is very, very essential. Okay, otherwise, what will happen if one eye is looking to the right, okay, one eye is straight, then that means the alignment is not there, right? So maybe we will not be able to see things as single and clear, right? Then there could be 2 images. Okay, it's called as diplopia or double vision. Okay, so for us to see things clearly and single, then this alignment is important. Proper alignment of our eyes, okay, is important. Okay, so then it boils down to the next question: then what is strabismus or squint? So it is a condition where both eyes are not aligned properly. Okay. Okay, so when both eyes are not aligned properly, for example, one eye is turning inside, it is called as ESO. The other eye is, for example, if it is turning outside, it is called as EXO. Okay, and if it is turning up, it is hyper, and if it is down, it is called as hypo. Okay, so if you see that the eyes are not aligned, okay, it is important for you to refer. Okay, in some parts of India, okay, it is considered that it is very auspicious. So, okay, those are all myth. Okay, don't believe those things. Whenever you see that the eyes are not aligned properly, you definitely have to refer them. Why? Because if you refer them at the right time, okay, at a much younger age, what will happen is there are options for correcting, aligning, okay, align the eyes, options to align the eyes nowadays, okay, so that once we align, probably we can bring back the vision also, even the last, whatever the vision that they have lost, okay, for a short period of time, okay. So it is important for you to refer. Otherwise, what will happen is they will end up in having something called as amblyopia. What is amblyopia? Suppose if a person is not used that eye for a very long period of time, that becomes lazy eye. Okay. It is very difficult for us to give training, exercise, and then bring back the vision if it is little too late. Of course, it is possible, but it takes time. But if it is diagnosed at a much earlier age, then it is easy for us to train. Okay, so here also your role is very, very important. So if eye alignment is not there, or eye alignment affects binocular vision, depth perception, and comfort while wearing glasses. Okay, why this is important for us to understand? Sometimes, when we prescribe glasses, they are not very comfortable. Because why? Because the alignment is not there. Okay, eye alignment is not there. Why? Eye alignment is very important, very essential to have both the eyes working together. If one eye is working very fast, the other eye is little slow, then also there is a discrepancy. The vision discrepancy is there. That means we are not able to appreciate the depth. Okay, so all this can cause dissatisfaction to a patient. Okay, even though we have done a good job giving the glasses, correct prescription is given, but this binocular vision or misalignment is present. Okay. Now the next is a prism. So what is a prism? A prism is a lens that bends light, okay, without focusing it. It is used to help align images seen by both the eyes. Okay. Suppose if the eyes are very deviated, okay, one eye is inside or one eye is outside, we can, possibly give them a prism, okay, to reduce or eliminate double vision. Okay, that is also possible. Okay, so we should know about prisms also, because sometimes when doctors prescribe, base in prisms, okay, or base out prism, so we should know how to see this in a lensometer. Okay, so the second exercise that I'm going to give you today is, you have to, each one of you should try understanding about prisms. How? If there are trial sets available in your center, there are prisms available in a trial set. So take out the prism, put it in the lensometer, and find out yourself whether, what is the number, whether is it in or out, all that you should know. Why? Because if there is a prism present in a spectacle, you should know what is the base direction, and also what is the direction in it. Okay, what is the whether is it base in, or whether is it base out, okay, or is it base up, or it is base down. Okay, all that you should be familiar. Okay, start today itself. Okay, so this what we give is we give either base in for this outward deviation XO and base out for inward and base up and base down. Okay. When we dispense these prisms, what is important is to look at the prism power. Okay, because these prisms are little heavier, little thicker, we need to select a very stable frame. That is very important because the lens is going to be very thick. Okay, and the adaptation also with prism glasses are very difficult. Okay, so you need to tell patients to get used to it slowly. Okay, because initially the adaptation will be tough, and slowly over a period of time it will be fine. Okay, now it comes to a question. Patient has correct glasses, okay, but still they cannot see clearly. What could be the reason?
Fitting.
Retina problem.
One would be retina problem. Here,
Amblyopia.
yeah, has correct glasses but still can't see clearly. Means retina, okay. Or there could be optic nerve as well, okay, problem. Okay. So imagine if a patient has got double vision, okay. So what do you expect? Okay, as I said, it could be because of the misalignment. Okay, so you need to refer to refer for binocular vision assessment. Okay, that is important. The second thing is, if there is a small squint with discomfort is present, possibly we can give them a prism glass. Okay. Similarly, if a child has an eye deviation, okay, the you see any small deviation also can give rise to this amblyopia or lazy eye. Okay, that's why I say that you always, if you suspect that the child is not seeing straight or it is seeing somewhere, then we need to urgently refer for a checkup. Okay, so this is important. Imagine a father is coming or a mother is coming and a child is next to them, but if the child is not seeing properly, you can refer. See, this is where your role, you need to understand that this child vision is not normal like that. Okay, so this is where you need to really play a role. So when to refer? So any visible eye deviation, if you come across, then you should, definitely refer. And or if there is a sudden onset of double vision also, you should definitely refer. Or if there is any abnormal posture or head tilt, then also you should suspect, okay, some vision issue. And then children with suspected squint, okay, sometimes they may see differently, okay. So whenever you suspect, then you can refer them. So the key take home messages are eye muscles are important and it controls the alignment and coordination as well. So which is very important for us to see things clearly and single. Okay. And prism lenses, it helps align images and not power. So opticians must identify and refer squint cases appropriately. Okay. Now somebody coming to you, say around 45 years, okay, they cannot read mobile. They are saying, see, I'm using mobile, but I'm not able to send messages. I'm making mistakes. Okay. These are very common, isn't it? So what do you do?
Give near vision power.
Yeah,
Near
could
vision
be.
problem.
Yes, could be near vision because 45, right?